Hi, we would like to present a randomized controlled clinical trial performed by Dr. Reyes, Dr. Collins, Dr. Contreras, Dr. Lantigua, Dr. Pithon, and Dr. Tanaka.
Most adult patients seek orthodontic treatment for aesthetic reasons, needing in some cases first premolar extractions in order to correct the malocclusion. This approach is known to increase orthodontic treatment time. In recent years, the field of periodontics and implant dentistry has focused on using blood derivatives for bone regeneration or preservation due to alveolus decreasing width and height during the first year post-extraction. The LPRF components help bone formation and angiogenesis. Therefore, the objective of this study was to evaluate the distalization rate and changes in the inclinations of the maxillary canines in a preserved alveolus with leukocyte-platelet-rich fibrin membranes in adult patients. The present study was conducted from December 2016 to December 2018, and a randomized controlled clinical split-mouth trial was performed. The experimental site received the alveolar preservation treatment with LPRF membranes, while the other site was the control. All patients were treated with pre-adjusted MBT brackets, O22 slot brackets, and the alignment and leveling phases were performed until an O20 stainless steel archwire was placed. A first CT was requested days before the surgical intervention. 15 days after the extractions, maxillary canine retraction began. The maxillary canine distalization rate was evaluated during 5 months, and canine inclination was compared with a second CBCT. 17 patients finished the study. All results showed greater orthodontic tooth movement in inclination on the control side than in the preserved side. Different research approaches looking for therapeutic options to reduce orthodontic treatment time have been described, but studies using blood derivatives are scarce. This is one of the first studies to evaluate how LPRF affects the orthodontic tooth movement. Probably, LPRF induced more bone formation, decreasing bones turnover, which is necessary for orthodontic tooth movement to occur. From a clinical point of view, the use of alveolar preservation procedures should be reconsidered. Using LPRF membranes should be reconsidered. We recommend that studies should be performed assessing the inflammatory process in larger population. In this study, the null hypothesis was rejected, and the use of LPRF membranes decreased the rate of distalization and changes in the inclination of the maxillary canines when compared with the control site in young adult patients.
We invite you to read the full article in the August 2020 issue of the AJO deal. Thank you so much for your attention, and stay safe.
Stay safe.